Hot takes, real talk, real issues, you know the deal. We keep it fresh, we keep it true. All Mary with the Voice podcast.
Born in France to Nigerian parents, no?
Mixed. Nigerian parents, and my mom is Nigerian. My dad is from Mauritania. You might be wondering, what is that? Not Mauritius. Mauritania. So we're still in West Africa. Did you read my
mind? I was about to say, wait, Mauritius?
Yes, Mauritania. So we're still in West Africa.
Okay. Mm-hmm. Nice mix. I haven't heard that mix before.
Yeah, I don't think we have any other mix like that.
And then you did your primary school in France? Or?
Yes. No, after my parents moved back to Mauritania. So I did my primary school in Mauritania, in Nouakchott. And then got a scholarship to study in Morocco. So I did my basic dentistry in the University of Rabat in Morocco. And finished in 1992. And continued back to France, I will say, to be able to do my postgraduate degree in dentofacial orthopedics and orthodontics, in prosthodontics,
and all the big jargons
and other things.
All the big words.
Yeah, I could go on with that. I did about six postgraduate degrees.
Sorry, what?
Six.
1, 2, 3, 4, 5, 6.
Yes.
Postgraduate.
Yes.
Degrees.
Yeah, some at the same time.
Indeed, you are an architect. No, you have to be. After doing 4 or 5. At what point did you know it was going to be dentistry?
That's a good question. To be honest, I didn't know I was going to be a dentist. My older brother is medical doctor, and I thought, okay, interesting. Let me follow his path. And when I went to apply for scholarship, they were like, okay, for medicine, it's over. You have pharmacy, dentistry, and I can't remember the third one. I was like, okay, pharmacy. I don't see myself being behind it. I had that image about, pharmacy, to the pharmacist who is listening again, but I chose dentistry. And from that point, I had no regrets about my choice. Yeah.
Lovely. So you did uni where?
I did university basic dentistry in Rabat, Morocco.
Okay.
And then the postgraduate was in the Université Paul Sabatier.
Sorry, you start. How did you just switch from English to, I'm hearing French accent, like, okay. Carry on.
Université Paul Sabatier, but that's in Toulouse, southwest of France. Yeah.
So you had to say it in French. It could not help me with English.
It sounded better.
It did. Very sweet.
Yes.
Say it again, please.
Université Paul Sabatier. Voilà.
Okay, so you did your degree there, and then how did you get to Nigeria? Sorry, yeah.
Yeah, after I finished, 6 years, with all the postgrad, I decided I don't want to stay in France. I actually worked for a couple of months and wasn't fulfilled, and decided to come back to Africa. Now, coming back to Nigeria was probably not my first choice because I'm just being honest. I always studied in French and spoke French throughout. Okay. And coming back to Africa, I was like, yeah, I come to Nigeria on holiday, etc. But the English that was in me was not enough, certainly, to converse professionally and all that. So I tried Senegal, and I was like, I'll get too bored here. I went to Côte d'Ivoire, and I know they had that Ivorian thing going on at that time. I was like, okay, I don't want to deal with this. And then my mom was like, just come home. You always come home for holiday. Just come and try Nigeria. And of course, at some point, I was like, okay, why not? And came back and then gave me an envelope, would say, okay, $5,000 here. Go get any consumables, materials that can help you, work as a consultant. And that's how I started. $5,000, guys, in an envelope. And that's how I was able to build, going from one clinic to the other, seeing patients. And yeah, that's really the beginning of my practice here.
The story is so amazing. So your mom literally bribes you with $5,000. You come to Nigeria.
Yeah.
Today we have Smile 360 in Ikoyi, in Abuja, and where else?
Oh, more to come. But just the
more
two
to
for
come.
now.
How did you grow $5,000 to Smile 360? What it is, $1 billion business?
Oh, we're not $1 billion yet, but hey,
I just prophesied.
God has just
prophesied
amen to that. That's
$1 billion.
I could see it coming. Well, for sure, I will say that it had to do with discipline. I was seeing one patient a week because as an orthodontist, the specialty was new. So there was very low awareness about, going to an orthodontist for what? So I remember I had this German patient, and I think the one of the big bosses at, what's the name of the company anyway? I forgot. And I saw her, fitted her braces, and she was meant to come and see me every month to tighten her braces. But because I was so bored, I was bringing her every week, but gradually, the word went round that there's an orthodontist. What is that? Okay. And of course, I was making it look really interesting. And I remember seeing one patient. I was working only on Saturday, but after about 5 years, it moved to me seeing about 120 patients a week.
You didn't give up?
I didn't give up. I was working not just one day, but started with the second day, third day, fourth day, fifth day. So obviously there's hard work, right? So people see you and think, okay, oh, you're so lucky. No, hard work. But the biggest one had to do with, the passion I have for what I do. And the passion, of course, comes from the beautiful smiles that I create, and that energy really feeds me. But the biggest one is discipline. How you're disciplined. You're writing down note by note. You're not taking any detail for granted and planning the next phase and analyzing what you can do better on the next smile. And also on the business side of it, how I take note of where those $5,000 have gone, the material, the equipment, and etc. And really investing back in the business and everything that took me where I am today.
Do you have major people that help you with investment? Because $5,000 obviously wouldn't have been enough as a business owner to just keep staff going yourself, equipment. They're not cheap.
Yes.
How did you get people to believe in your vision to help you set up the business?
Yes. So obviously I didn't start by owning a business. I started as a consultant, and I invested in a suitcase where I had a clinic in a box, and I was going from one clinic to the other. So of course I had a sharing formula where I come in, I see your patients, and of course I pay for using the space, and I get paid for my skills and the tools, the consumables, etc. that so that system really helped me, because I didn't have to put something down. I didn't have to invest in the walls and and the infrastructure. I own the clinic without owning the clinic. I own the patients by sharing with the clinic. So it really helped me, and I did that for 12 good years.
Oh, you labored. You put in the work.
Yes, from 1998 to 2010, when I decided to be on my own and launch Smile 360.
Oh, so you did put in the work.
100%.
Nice one.
And I enjoyed it.
Dentistry. For some reason, I personally want to understand, why is dentistry so expensive? Not only here, globally. Anything dental. Insurance companies don't even want it on their packages. Please, why is dentistry so expensive?
Very good question. The first thing first I'll say is that, hey, you have a dentist in front of you, not just a dentist, you have an orthodontist. You can't imagine what it took me to be where I am today. In terms of the studies, you have to study biology, biochemistry, physics, biophysics, and anatomy. I mean, so many things that goes into the education. And once you decide to set up the tools, materials that you see around you, I mean, you come into a dentist, you see just a chair. right? Of course, some scary gadgets coming out of the chair, of course, but you can't imagine what is beneath that chair, right? So there's so much that goes into setting up, a dental office. But I'll say for me, the biggest one is not the material, it's not the equipment, it's those skills. Yeah, those skills as dentists. It takes a lot to become a dentist. And beyond that, 6 years on top to become an orthodontist. That is something that we need to pay for, right? And I will say the impact we have on our patients, right, on their oral health, on their smile, that is not an expense, it's an investment. So yes, if you want a beautiful smile that will change your life, transform your confidence level, get you all the contracts that you are thinking about having, or just, give you that self-esteem, you can't count that as an expense. It's an investment for life. Yeah.
Okay, so investment for life. Some people appear to have been gifted with that investment before coming to this life.
True.
Great set of teeth, genetics or environmental?
Oh, very, very good question. Very, very good question. Because sometimes I see a patient who's, 50 and he's like, this is the first time I'm coming into a dental office. I'm like, whoa.
How?
Good genes. And I'll say bravo to your parents, Of course, there is a genetic aspect, okay? So that is, I will say, the frame that is given to you, right? Now, the sketches and everything that goes into it has to do with your habits.
Okay.
Has to do with your nutrition. All right. But I'll start with nutrition because there's a lot that goes into, sugar intake and tooth decay. We can talk about it. But like anything, and your overall health, yes, you may have good genes, but your habits are what will determine, how far you can push those genes and how far you can be healthy. So yes, the genetic is there. The environmental, influence is there. And of course, your habit and how you take care of your oral health. And I'm sure we'll talk about that. Yes.
So definitely you agree that there is a genetic aspect to it. You have to have the foundation.
Yes.
So some people you're saying now will come with, they're not lucky with having good dentition.
True.
Lovely.
True. And there's so many mixes these days where you may have the genes from the mother, dad, and even if, you have the mother's jaws that are a bit smaller, you inherit dad's teeth that are much bigger, put them together. And that's why you see, a lot of the teenagers coming with teeth that are like overlapping and crowded. And you wonder how, my mom doesn't have that, my dad, but the combination of those two genes also will lead to a new condition. And we're here to be able to explain and help you out. And there's no reason for you to stay with that when there's a solution that can transform your life.
Interesting. So a combo of my mom and my dad can help me have teeth all over the place.
Yes.
But they on their own have great teeth.
Exactly.
Lovely. Losing situation.
And then think about the future generation, the mixes, etc., etc. So that's why we would never be out of job for a day.
That's good for you, isn't it? Okay. Sugar. You mentioned sugar just now.
Yes.
Sugar and its impact on teeth, on children, teenagers, and adults. Children, the reason why I'm throwing the kids in is because we tell our kids, oh, sugar is not for you. Your teeth will have holes. But then we know that they're going to lose those teeth anyways. New set will come in. So please, and I hate to say what I'm saying right now because yes, my kids will see this and say, Mom, you were wrong. You lied to us. Sugar and kids.
Yeah.
Kids after losing their first set of teeth, and then, the adolescents and then adults.
Yes, thank you for that. Well, sugar is there with a natural. We need sugar in our life, right? We need.
Do we?
We need sugar, and that's why you have sugar even in the vegetables and what we eat, even as healthy food.
So you're talking
should
about
have
natural sugars.
natural
Don't let us give
sugar.
the wrong message out here.
About the extra
Yes.
one. We need some sweetness in our life. The question is, when?
Are you promoting your job at this point? Because if you're encouraging us to eat sugar, that's like, we will come and see you at some point.
Well, you have sugar everywhere. I'm not talking about sweets and sweets per se.
Yeah.
So we're talking about sugar everywhere. Sugar is everywhere.
Right.
And we need to enjoy life. This life has to be sweet, right? So now, talking about the babies, all right? So you will have your first baby tooth about 6 months, right? And you will have your first permanent first adult tooth around 5 years, 5.5, 6 years old. So now between that, you're thinking, okay, the child has baby teeth. He can eat as much sugar as he wants because his teeth are going to change anyway. I'll say no. The first thing that usually happens with babies getting hooked to sugar is when parents want their baby to sleep through the night and start preparing that milk bottle with some sugar, next to the bed, so that when the baby is going to bed, they just, plug in the
formula,
the formula, and then the baby eats, sleeps, wakes up in his sleep in the night, and just, hooks on to the bottle. That is the worst thing, you can do for your child. So if you're doing that, please stop those night formula bottles, because the sugar stays on those baby teeth, right? And they actually get those teeth rotten, right? And I will explain the principle. And we have children that are 2 years, have all their front teeth black. Now imagine putting a 2-year-old on a dental chair because he has advanced abscesses that are due to the tooth decay that, started from the feeding bottle and that was given at night. So that's the number one enemy. Now, why I'm saying no to sugar, even to babies, I'm not saying those party packs, what will I say, being full of sugar and all that, is more about them not getting the habit early to getting used to sweet things and sugary stuff, so that even though they're going to shed those baby teeth, let's think about habit. And that's really what I'm here to insist on. When they have their permanent teeth, if they have the habit of eating as much sugar, then they'll do the same thing with their new, fresh adult teeth, okay? That's even in their young teens and teenage. So habit is what I'm speaking about. Yes, we have tools, toothbrushes, to be able to take care of our oral hygiene, but I always bring it to, let's have the habit of cutting off sugar early. As adults, why are we taking sugar? Okay, we may need the sugar in the ice cream once in a while, but I will say, yes, if you have those habits of brushing right after that, then, remember that the sugar is not just about the teeth. There are other aspects of your body that will say no to sugar. I'm sure we'll talk about that. So sugar, whether when you're a baby, 2-year-old, 6-year-old, 12-year-old, or an adult, the sugar is the number one disaster, silent killer of your teeth. Okay? So, yes, I've talked about how, you have oral habits that will help you there, but it's for you to know that there are 3 factors. If you have sugar, you know that the mouth is the area that you have the highest number of bacteria. You have millions of bacteria in your mouth. Even if you've just finished brushing, they are there, waiting, hungry. You give them sugar. The 3rd factor is time. If you give them sugar for a minute, okay, that's all they can get. You give them for an hour, that's all they can get. But if you've had sugar throughout the day, you have not brushed for 12 hours, and you go to bed without brushing, imagine what will happen. The sugar is there, even more. The bacteria are there. They're feeding from that sugar, and they're multiplying. If you had 1 million, by that evening, you have probably 2 million. By the next morning, there are probably 6 million in your mouth. I'm just using those numbers for you to know how fast they multiply. And these bacteria will be producing acid, once they eat sugar and you give them time, remember the sugar, bacteria, and time, you've given them sufficient time, they will be eating sugar and producing acid. And acid is just like the acid you have in the car batteries. Just take a drop of acid on what? Piece of paper, whatever. It makes a hole, right? So that acid is on your enamel. That is solid, well protecting your teeth. But if that stays for the longest time possible, and they find hidden area, because the tooth anatomy is quite complex. I love how we were designing teeth in dental school. So they find hidden areas between the tooth and the gum or in between teeth. And that's where they start, building tooth decay. And then one day you wake up and you're like, what is this sensation? I'm taking something cold. I'm taking something sweet. I'm feeling something that is going. And you're wondering, okay, we'll talk about some of this DIY. Yeah. But you get to a stage where you can't even sleep. You start having pains that keeps you awake. And that pain could be so excruciating that you feel like banging your head on the wall. Toothache is one of the, someone told me that it's probably worse than childbirth, right? So you don't want to experience that. I don't have to give you so many other horror stories. And that's why there's so many horror stories about going to the dentist, because toothache is painful. And it begins with what? That little cube of sugar or that sweet. So in between, you need to know, how do I manage my sugar? How do I manage the time? And how do I manage the number of bacteria in my mouth to make sure I brush? I use good toothpaste. I use mouthwash to reducing the bacteria, as much the bacterial load in my mouth. And of course, giving them the least time possible, if at all. I have to have some sugar. Let me go and brush immediately.
Oh, so that's the genesis behind the brushing.
Yeah. The frequency of the brushing. Just work on that time.
For them to multiply.
I know you need something sweet in your life. But
kill them.
Yes, make sure. Keep it at a controlled level.
So that's kill them. Brush.
Yes.
Lovely. Mouth odor. Is it a disease? Is it something inherited? Genetic, or is it something self-inflicted? How can I get rid of mouth odor DIY?
Wow. The most difficult, and this is such an interesting question, that people like to hear about. And the most difficult part of the mouth odor or not having a fresh breath is the fact that most of the time you don't perceive it yourself. And that's the part that's even more devastating.
It's a lie.
You don't.
No way. Come on. Some people should know.
That's what you think. You must have probably put in some perfume this morning or maybe this afternoon.
No, but can't you
perceive it?
Can't you taste mouth odor?
I put on perfume today, but I can't even smell my perfume anymore because it's an internal mechanism that gets accustomed to the smell and the odors around us. So once you don't hydrate, you're prone to having mouth odor. So let's start from that. That's a local one. But to your question, there are other factors, I wouldn't say genetic, but other physiological factors, some things that could start from the stomach, right? Or you have some of these gallstones or you have just a stomach condition that gives you acid reflux. And those can actually lead to destroying your teeth, the enamel. Remember, acid is acid. Whether it's acid produced by the stomach and you're having this reflux, or acid produced by the bacteria is acid. But that could also give a certain smell, and because it's internal, you may not even perceive it. So you will have some of your colleagues at work trying to be polite, or you have a wife or a girlfriend trying to respect you because they're like, how would I talk about it? I have some patient being ambushed. They told me about the wife will come, for example, and tell me, I don't know how to talk about it, but, just bring your husband for a cleaning. And then we talk about it professionally. But I will say to others out there, whether it's mouth odor or body odor, if you're a good friend of that person, talk about it. The person will appreciate you for life. I mean, we have to be genuine, right?
Appreciate you or cut you off. No, these days they block you. These days you get blocked.
You get blocked.
They just block you on all socials.
Well, then that's not a good friend, because you have to find the right word. I know it's difficult, but yeah. So as I said, it's a local factor. Pay attention to your nutrition. Of course, there's certain food that will, not help. I mean, garlic is good, for example, onions, etc. But they don't help, right? The anatomy of your teeth and how well you brush. Remember that time factor. If you stay too long and you leave things, in your mouth for too long and you don't floss, especially, I'm bringing that floss there, because things get trapped between the teeth, and it's like having a little bean with something that is stuck between the teeth that stays there not just for hours, for days, and you wonder, why is my breath not fresh, right? So brush, floss, certainly. And mouthwashes, I'm not a fan necessarily of mouthwashes, but visit your dentist, of course, twice a year, and he will tell you if there are conditions that helps to maintain that. Okay, we'll talk about gum disease and all that. Yeah.
So how do I smell my breath? How do I do that? Just so that I won't have it on another person telling me, say, Is that how
you've just done it.
Oh, that's it?
Yeah, that's a test. But something has to prompt you to do it, because you don't go around.
I don't want anyone prompting me. Say, like, she has bad breath. She's pretty, but she has bad breath. How can I check my own breath regularly?
Yes.
So that I don't have another person telling me.
Yes. So just like the body odor, can I smell
how
myself?
can I do the breath test? DIY breath test.
Breath test. Well, putting your hand in front, certainly, and then,
And then do...
that might be that moment in the morning. What happened to the next few hours after?
I can do it regularly during the day.
I mean, imagine how many things you have to test on your body, and you have to do it yourself. Well, I will say, if you stick to your regular visit at your dentist, the dentist will be able to perceive, to look at areas that could make you prone to bad breath, and just tell you straight away, look, we need to be careful about this, or this is what we have to do, even if you didn't know about it. You can do the test, but I will say you can't keep testing yourself every day, every week, I
can come seeing you every day, every week.
Yes, but that's normally you're not supposed to have it if you do the right thing, right?
Right.
And you hydrate. Remember, we talk about there's a lot that has to do with your oral health.
So I have to do that regularly. Hydrate
for other reasons. Exactly.
Right.
But there are other times of the month of the, as I said, this season where you're fasting, and if you're doing dry fast, for example, you can't drink and you will be prone.
Right.
Okay, so perhaps wake up, drink a lot of water, maybe swallow your saliva, be mindful. If you're able to rinse without swallowing, just be mindful that things can happen depending on condition. There's on that time of the month, even for ladies. Yeah.
Sorry, what?
Yes. Something
why
more.
Are we,
why us again?
Why? How does that got to do with my oral health?
Yes, because it's the hormones changes. Pregnancy. We can talk about pregnancy and oral health. So yeah.
Yes. Just to deviate a bit.
Yeah.
How does pregnancy affect our teeth? Because I heard, and I think I did that too. My teeth changed after having, I think, my second child. How does that affect our teeth, pregnancy?
Yes. I had someone saying for every child, she had 4 kids. For every child, she lost a tooth, like every time she's pregnant is, and when you're pregnant also, there's little to what we can do also in terms of treatment. Hence, hey, do your regular check even before you get pregnant, because once you're pregnant, there's some part of the semesters that are critical where we can't even take x-rays, and there are certain things that we cannot administer, etc. The hormone changes during pregnancy doesn't affect the tooth per se, but it affects the gums. Okay, so you feel area where your gums are quite flabby, and then more prone to food, bacteria getting stuck in between the tooth and the gums. Your gums are bleeding more, and because they're bleeding more, what happens? Just a drop of that blood from your gums into your mouth that will give you that. I know the word in French. That ferric, like iron type of
What's
taste.
the word in French?
Ferric.
Okay.
Yeah, okay. But I'll say that iron taste in your mouth, that is bad breath. Okay. So let's be careful when we're brushing. I'm sure you brush sometimes and you see that blood on your toothbrush. You're like, not important. Yeah. That's a sign that, we're going in a direction that we need help. Okay. So during pregnancy, your gums will tend to bleed a bit more because of all these hormone changes during your cycle as well. So you want to make sure that you're even more, attentive to brushing, flossing, using mouthwashes, or, So ladies
Can't get a break.
can't
Literally,
get a
ladies, I
break.
just finished that sentence for you.
Yeah.
Ladies can't get a break. And I'm
Exactly.
annoyed.
You just have to be more
Intentional.
demure, intentional. Yeah.
What are the common oral diseases you've come across in our culture?
Okay, so one thing for sure that is a cuts across all cultures, all continents, all ages is definitely tooth decay. Right? Tooth decay. Yeah. I have a hole in my tooth, and you can't fix it. Forget about DIY. Okay. Once you have a hole, before we get to that part, let me even talk about it now. Because once you have a hole in your tooth, you need to go to the dentist, because once you've lost enamel, it's a piece of your tooth structure that's gone. It cannot rebuild itself. Okay?
No cell there to grow it back?
Yeah. That has not come up yet. Okay. So we need to go and get a filling to be able to clean up and get a filling. Okay. The next thing is gum diseases. And that's something that's quite underrated. And it's even more prominent in our in Black nations. So we need to make sure that we pay attention to the health of our gums. Okay. To the health of our gums. So when brushing and you see a bit of blood on your gum, that's the first sign of, gum disease, which is gingivitis. And if it's not taken care of, then we have even more advanced what we call periodontal disease. Again, that is also linked to our overall health as well. So we'll talk about diabetes and gum disease. We'll talk about, kidney and gum disease. We'll talk about heart problems and gum disease. Yes. Yes. And so many other things. Alzheimer has been even linked to heart disease. And it's strange how on the 20th of March was the World Oral Health Day. And the theme for this year is healthy mouth, healthy mind. Because you'll be surprised the connections that we have between our oral health and our overall body. Call it the heart, the kidneys, the lungs, and the mind, of course. Yeah.
So we have which other disease that
So
are
we
very
talk about the
prominent?
decay,
The decay.
gum disease.
Yeah, the gum disease.
Yes, and I will speak to malocclusions. Of course, I'm an orthodontist. Okay.
I'm about to ask you, what does that mean?
Yes. So malocclusion is when your teeth are not aligned. Okay. So we talk about the crowding aspect where the teeth, are overlapping because I feel like I have too many teeth in my mouth, right? But you're talking about something that is more prominent here. I'll speak to open bites because we tend to have the volume of our tongue that's slightly much bigger than what we find in other ethnic nations. So, and sometimes even the way we speak also has an influence. Okay, we like to speak with our mouth open, pronounce in a certain way and all that. So that tends to create what we call open bites, okay, where the upper and the lower teeth are not meeting. All right. So they're meeting at the way we speak, the way we position our tongue, the volume of our tongue creates what we call a malocclusion, which is, an open bite. So a bite is not settling the way it should be. All right. So it's interesting, to know that impact.
Symptoms of oral infections and diseases. What can we look out for?
Okay, I think we've talked about
the bleeding gums. Okay, for the younger ones, of course, and the younger adults, I'll say most times we are more prone to tooth decay, right? So the first symptom there will be, I'm taking this water
cold or not, and I'm feeling this sharp pain on my tooth. Okay, so that's a sign. All right, or I'm taking something hot or cold and I'm feeling this sharp pain on my tooth. So that's a sign. For the gum disease, is that bleeding that we talked about, on my toothbrush. It's something that definitely, gives a signal to say, hey, it's time to get help, But sometimes you can brush much longer that area. And if you see, so again, when you see that bleeding area, you have to look where you're brushing. Let me start by that. You brush in front of a mirror. Don't brush with your eyes closed. And don't brush with a hard brush. All right?
We'll get there. But wait,
all right?
Since we're on the brushing, how long should I brush for? Like, nobody taught me how long to brush. I'll just do, it's the sort of, okay, I think I've done enough. That's it. How long should I brush for?
All right. I'm not going to sing along with you because
please
I know
do sing along. I need
for the younger one.
No, let's give the adults a sing along because I know some of these guys need some sing along. Okay.
Yes.
So we know how long we need to move around
to brush. Oh my God. Why is that coming back to me in French?
Sing it. We'll learn a French song. It's sexy anyways.
Du rouge vers le blanc, en haut, en bas, de la gencive vers les dents. N'oublie pas les molaires, les dents qui sont derrière. Brossez-les bien avec de mouvements circulaires. All right, so
that's about, 40 seconds? That song wasn't long.
That wasn't long, but that's for one arch. All right? And then, or half of an arch, then you move to the other side. So let's talk about this.
So add like 40, so we're looking at almost 2 minutes or so?
You should be doing two and a half minutes.
About 2 minutes.
3. Yes.
Lovely.
Depending on the number of teeth you have. So I'll say stay.
Sorry, number of
and hopefully you're keeping all your teeth nice and healthy.
So the less
Please keep all your teeth.
It's not meant to be funny, but I get it. So if I have 5.
Oh, wow. Well, gone are the times where people are having, now you should be keeping all your teeth, to be honest. There's no reason why,
But some people can't.
Some people can. No, but, we see less and less people going around with full mouth dentures, you remember?
Right, yeah.
We used to have, our grandparents going to bed with those dentures in the glass, by their bedside. So things are changing because we are here and we're creating that awareness and we're here for you.
Fastest way to ease a toothache, DIY.
Okay.
I'm not coming to see you. But if I have an issue, what's the fastest way to ease the pain? And at what point should I really come and see you?
Okay.
With the toothache.
All right. So we need those DIYs for sure. I know in the past, people used to talk about cloves. Yeah, those cloves, Why? Because the content of some of the fillings that we're using for tooth decay contains clove. Yeah. Clou de girofle. Yeah, cloves in French. Okay. In English. But I will say the first thing first is, of course, brush, even if it hurts. Okay. Brush that area. And that's what we're talking about. The toothbrushes should be soft, extra soft. So yeah, brush and clean up. It's important that you clean up that area. My favorite of all, whether it's for the tooth decay or the gum disease, is warm salted water. All right. So just a level teaspoon of salt in.
Sorry, a level
teaspoon, just a little bit of salt. Yeah. And in warm water. Okay. And then you rinse. Just gargle with that. Okay, that will really reduce the inflammation and sanitize that area. And that should be able to keep you going, whether you have a tooth decay, a gingivitis, that's an early sign of gum disease, or even a wisdom tooth that is trying to grow with the inflamed gum around it. So that's really the first DIY. I'll say warm salted water, rinse, gargle. Do that 3-4 times a day, but make sure that you already have your appointment booked.
Because, I was going to ask you, at what point do I really have to see, or with my teeth, the pain will tell me when to come?
Well, I would say from the time you already felt the symptoms, call and book so that if the appointment is not available today, you have 2 days maybe doing your DIY, but don't wait, because the more you wait, it gets worse. It gets worse. That means it's going to be more pain, more time for the dentist to work on, and more money, right? So Please don't wait. Just we like to treat things at an early stage. So you're smiling as a patient, and we are doctors are smiling too.
Diabetes and dental care.
I'll start by talking about a story of a patient who came and said, I've been checking my blood sugar level. I'm taking my meds. I'm doing everything possible. But for some reason, my blood sugar levels are going higher and higher and higher. And when we checked his gums were red, inflamed, and the bleeding, you didn't need to touch the gums for them to bleed, And I told him that he had infection in his mouth, and the body is one. Those bacteria in the mouth, remember, that have been there for a certain time, through the vessel that will crack, that's bleeding, those bacteria are going in there through your entire body. It can go and get fixated on your heart, on your kidney, everywhere, right? And that actually was what was keeping his blood sugar level high. Oh. So he had a basic scaling and polishing. There was work to be done. He did it over 2 sessions. And from the time he was able to control the bacteria in his mouth, guess what happened? His blood sugar level dropped. And he doesn't joke now with his regular checks and regular
So it wasn't
clinic.
his food, nothing. It was in the mouth.
So that's a big connection. So take care of the body is one at the end of the day. You don't want to keep any infection, any inflammation site. Yeah.
So what if one has diabetes and they lose their tooth? Can they have the tooth fixed back like an artificial one, or how does healing affect the gums when I have diabetes, like type 1 diabetes?
Okay. Well, that's a very good question. Of course, we work with the general practitioner to be able to know how we have to handle the meds, etc. What is the right time to come in? And sometimes we may not be able to do anything too invasive, right? We can do bridges. We can do things that don't require drilling an implant into the bone, or it all depends on the local condition, and the health of the patient. Okay, so we definitely adapt, and most importantly, we work with the GP to be able to know how to manage his meds, get him to a stable situation so we can come in. Yeah.
So there are diseases that will affect the treatment of the teeth.
Oh yes, definitely. There are diseases that, because, you touch the tooth, the gums start bleeding. So if you're doing an extraction, for someone who is on certain medication, you need to know. And you need to make sure that he stops his aspirin or, So patients who have heart conditions, we definitely work with their physicians to be able to know when to come in. Those who are going through, cancer treatment, you'll be surprised that they have to come through the dentist to be able to do sometimes total clearance of any area of infection, of not to affect even their cancer treatment, So it's a very well integrated space, and I will say everything begins with the mouth. Right?
I've heard everything begins in the gut.
Yeah, the smile, everything begins with the mouth. We eat, it begins from the mouth.
Right.
We connect, it begins with the mouth. Right? You're shaking hand, it begins with the mouth.
Really?
I mean, who else, than a dentist can just make you, feel good, look good, and then conquer the world.
I know a few people, but I won't mention. Okay. In our culture, we did like to chew bone way well.
Tell me about it.
That's it. I know of one of my kids that likes to chew bone over eating the meat. I don't like chewing bone. My child does it. I don't know where she got it from. Please, is it an exercising for the teeth, or is this something we need to stop?
All right. I have to speak for myself because I like bones as well.
You own the whole clinic. We can't even compete with you. You break your teeth, you fix it yourself.
I fix it myself.
So please.
That's very funny. But these bones are
be careful. We need to hear. Okay, let's do professional now. Okay, so Dr. Amy likes to chew bone. Whatever she says now is going to be professional. We're not going to discuss her love for chewing bones.
Yeah, yes,
Please, let's be
yes,
professional now.
No,
so that
let's
we
let's
know.
respect our teeth. I will start with, thank God we don't have those old bottles of Coke. I mean, drinks. I mean, not bottles. All right, where we are.
Yes,
opening.
Me, tomboy too.
Uh-huh.
Not only you, my brothers taught me how to do that.
How to open
and I was proud
cock.
I could join them in.
Yeah, that's
in
even
doing
worse. That's even worse than a bone, So I will say,
but you know the honor in being able
yeah,
to
do that. Opening with like, you hear that sound and you feel good. We just have to, overall, as I said, it's habits. We have to respect our body. Yeah, it doesn't mean we can't do it. We can get away with it now. But, when you're chewing bone, it's not so much what you see, what you feel, okay? Or anything that you do with your teeth. It's the cracks, the micro cracks that happen within the enamel, that you cannot see, you cannot feel. That will just be accumulated within the tooth. And then over time, over the age, one day you're just eating something soft, maybe pap, and then your tooth cracks. And you wonder, I was eating, and the patient come to me to the clinic and say, trust me, I was eating a very soft bread, whatever it is, and this happened. I don't understand. I say, well, what were you doing before we got to today? Is really what has been accumulating in the tooth. And those mini cracks, are able to, got us to where we are today. So let's take care of our body. We want to enjoy it for the long haul.
So it's not necessarily the one time, it's over the years what we're doing. So it might catch up with us when we're older.
That's what I'm saying.
As grandma and grandpas.
Yes.
It will catch up.
Well, now we know. So hopefully we'll stop.
I always struggle buying toothpaste. I think I change toothpaste maybe 3-4 times a year because I don't know which one to buy. I will see a new one that looks green. I'm thinking, oh, it's organic because it looks greenish. And then I'll see one and the kids go, no, we don't like the taste of that one. We like that one. And then I'll hear fluoride. Fluoride, buy the one without fluoride. I'm like, what is that? Why am I looking for? And then I'll see one that has charcoal in it thinking, oh yeah, charcoal. I heard it's healthy, activated.
Activated charcoal, yeah.
I struggle and I believe I'm not the only one. Please, what's up with the toothpaste market? Which one do we really need? Do we even need toothpaste? Can we not just go with the finger like that and just, clean it? Yeah. It's not just bacteria we're trying to get rid of.
Correct.
Can I just not use my finger with water and or salt? You said salt can... What's up with the
salt?
Please.
You're so right. I mean, you would have heard also about those herbal toothpaste and all that. There's so much. And sometimes I have patients even coming to tell me, this is what I've seen, this is what I read, this is what I've been doing. I'm like, okay, now you're educating me on this. So I'll say bottom line is, just like when you're having a bath, right? The soap, pouring soap over your body is not what will keep you clean. It's how you're able to scrub, right? Your body and the various areas. So I'll say prioritize your toothbrush, okay? And the selection of your toothbrush.
Okay, since we're doing the brush and the paste, let's do the same because when I buy soft toothbrush, they almost beat me at home. Why didn't you buy the extra hard one? I'm thinking, you hurt your gums.
That's correct.
So they're like, no, but I want to make sure that it's clean.
Yes.
So now so the brush and the paste.
Yes.
Help us out.
Talking about the brush, let's quickly talk about the brush. A soft, I'll say maximum medium. Why? Because you need to brush your gums and your teeth. All right. We should learn how to tell our children, even from the younger age, go brush your gums. Go brush your gums instead of saying, go and brush your teeth. Go and brush your teeth.
So wait, we're brushing for the gums, not for the teeth?
Yes. Because the area that needs to be brushed is really the neck of the tooth that is coming out of the gum, right? So that area is where the bacteria and the plaque, right, which is an accumulation of bacteria and the nutrients or remnant of what we've eaten. So that's where it settles, just where the tooth is coming out of the gum. If you go brushing your teeth, you may brush your teeth, but you may forget to go a little higher or a little lower, depending if you're brushing.
So that's the point of brushing my teeth?
So if that's the point of brushing your gums, if you brush your gums, then you cannot miss that area where the tooth is just emerging, erupting from the gum. So brush your gums, gum to the teeth. That's the movement from the pink, depending on the color of your gums, from the pink to the white, okay? And if it's the lower, it's the opposite, right? It's up, down, or down, up. So brush your gums, brush your gums, brush your gums. And for that, you need a soft toothbrush. As you said, you can't go with a hard toothbrush. You're going to hurt.
No, because I think the idea behind the hard brush is the teeth itself. Yeah. How can I get it to look nice and shiny?
Mm-hmm. But remember that the teeth are glossy and nothing sticks.
They look like ceramic.
Yeah, nothing stays on the teeth. Nothing stays on the teeth because everything just drops. It's really at the neck of the tooth that's where things get stuck. So you need to brush the gums and the beginning of that tooth to make sure that you're able to take away,
So that's where
plaque.
we're actually focusing on when we're brushing.
Yes. And that's why you need a soft brush.
What about the tongue? Some people literally almost vomit. They go deep, thinking, let's remove mouth odor.
Yes.
What's up with brushing the tongue?
Okay.
That's it.
Very good. So, very good. You need your soft brush, soft or medium. There's even extra soft now, and you'll really enjoy
So
it because you need a massage. You need a tooth massage. Really? That's what you're doing when you're brushing. You're not brushing those hard jeans, because sometimes you hear someone brushing his hair like, are you scrubbing your jean trousers or whatever, because you hear the sound, I don't want to mention name, but I think my husband does that, But when he hears me coming closer, then you see the noise, he reduces and he's like, but otherwise he's like, and then as soon as I come close, he just smiles and it goes soft, But get your soft toothbrush, and that's what you need. You need a tooth massage when you're actually brushing your gums, right? And your teeth. Now, talking about the toothpaste, several toothpaste, but having the right toothbrush is already, I would say, 80% of the job done, right? The toothpaste will be the soap that just makes things slide and facilitate, okay? Of course, if you have fluoride for children, it's very important because the enamel...
Free or fluoride?
Fluoride for the kids. We need fluoride, I would say, up to about 9 years old or so, or even 12, so that this fluoride goes in reinforcing the enamel. Remember, at that age, cavity is what we're fighting. We need that enamel to be stronger. It's as if the tooth is wearing a helmet, so that even if they don't have the full habit of brushing and some bacteria are staying overnight, hopefully not, at least the acid attack will not affect our tooth, and we're reducing the prevalence of tooth decay and those holes in our teeth. Okay. So fluoride for sure, I'll say the activated charcoal, the herbal, I'll say more adults are going in that direction. And the big benefit is more for the gums than the teeth, because the teeth are formed, they're formed. Whatever you're putting over around doesn't change the structure of the tooth, but it's really about how do I get those gums healthy? How do I reduce inflammation around? I know the activated charcoal will help a bit on the gum, but there's that impression that my teeth look whiter because of the, that contrast that, my gum looks suddenly a little darker, my teeth look whiter. So it makes you feel good, right? But I would say without a good brush, everything else, would not give you the impact. Okay. Toothbrush, soft. Toothpaste, a good toothpaste, depending on your age. Your dentist will also guide you there, what works best for you. And then your mouthwash, I will say avoid anything that has too much alcohol. My favorite, warm salted water, and don't abuse. Well, you can have something that also tastes good, feels good, and have some astringent effect on your gums. It's good, but don't. Remember the bacteria in the mouth. They are there to help us as well. So you don't want to overdo it, because you're actually going to weaken the flora of the mouth. Okay, so it's all about balance, really.
There was something I said I wasn't going to show you until we started, because I wanted to see the effects. Now I used to see my grandfather do that a lot. And I said I was going to wait and show you. So now, a lot of our old people, you see them chewing on these in the mornings to brush. You see them, they just, play with it.
Where did you get it?
I wanted to surprise you.
Yes. Can I have a stick?
Sorry. So, yes, I'll give you a stick, but you need to explain to me.
Yes.
They use this all their lives. They never use toothbrush, toothpaste, nothing. And they hardly, if at all, know what a dentist is.
Mm-hmm.
And they left this world with all their teeth together.
Fantastic.
Using only this.
Love it.
So what's the science behind using only
the chewing
this?
stick. Can I have one?
You want one?
Please.
Sure. I'll give you
All
one.
right, one. So that'll be my prop for today. Yeah, because I needed to have a prop or something to show what I do. So this is so. Maybe you've done research on what I've done, because during my studies, I did actually my thesis on chewing stick.
No way.
Yes. I did my thesis on chewing stick. This stick is so powerful. There are so many. Of course, you don't just cut any branch of any tree, to make a chewing stick. Okay. They will know, actually, our parents.
So it's not just any wood.
Yeah, they will know the type of wood that you can go. It has to be soft enough.
Oh.
But the biggest part will be, number one, the mechanical aspect. I have to chew on it up to a certain area where the bristles come out. Mm-hmm. And that does what? I've got a toothbrush. Okay. Then by the time I chew on it, the wood itself has some chemicals that have some properties that will almost work as the toothpaste, So there's some that have like a mini soapy effect. So when I'm brushing, it actually makes everything look so clean, right? But beyond that, there are other properties that, can reduce inflammation. So in this, you have the equivalent of a brush, a toothpaste, and a mouthwash.
Oh, mouthwash too?
Yes.
Okay.
Because you have some chemicals that have anti-inflammatory, antiseptic effect, which is what your mouthwash or your big brand mouthwashes are doing. Mm-hmm. I can tell you that they got this from the beginning, right? Now, of course, everything is commercial. We're talking about how we have to progress with, but it's also created a problem, because there are some families who cannot afford to change their toothbrush. And by the way, we change our toothbrush every 2 to 3 months because the bristles get, but as some families can't afford it, you have someone that has the same toothbrush since he was 2 years, he's 6, he's still carrying the same toothbrush. Or you have some families now where they have one toothbrush for everybody, because they can't afford for everyone to have his toothbrush, everyone changing his toothbrush and all that. But imagine if we had this stick growing in our backyard, everybody will have his toothbrush, his toothpaste, and an amazing mouthwash.
So it's definitely a go-to.
Well, it may not look sexy, but it's definitely something that could really solve quite a bit of concerns we have.
Last question on this one.
Mm-hmm.
What about people that have dentures or other implants or work done, cosmetic surgery done? Mm-hmm. Can they chew on this and use it to clean their teeth as well? Okay,
so of course I know this is, before you get the bristles out, you have to chew on a bit of wood that's a bit hard, and which is what we're talking about. And perhaps, as we're progressing in the 21st century, we're progressing with new tools, etc. Because now you have not just the regular toothbrush. I'm going to drop this. Mm-hmm. You also have the motorized toothbrush. Mm-hmm. Yeah, they will have Superman. They'll have Barbie on it. They'll have, But for the adults, you have, the motorized toothbrushes that will help when you have specific jobs, specific dentures or dental work in your mouth. You have the water flossers. Things that really help you, that are really adapted. What I love dentistry is that there's so much technology, so much that advances have changed the way I saw dentistry when I graduated compared to what I'm seeing now. So there's so many things that makes dentistry more easy and enjoyable for me, but also so many things that makes, dentistry and oral health exciting for patients. Mm. So many things that make a visit to the dentist exciting as well. So,
toothpick or dental floss?
I would say no toothpick.
Why not?
No toothpick, because, oh my God, restaurants that are keeping toothpicks on their table, I hope you're listening, right? You need to take that out. Why the toothpick? Because when you go picking between your teeth, taking away whatever got stuck there, what happened most of the time is that you stay with the toothpick even beyond after that has come up, and then you're poking and poking and poking. So the gum that is between two teeth is now pushed away. And the next thing will happen, you have a bigger hole, bigger space where a bigger chunk of meat will go in. So it's like a vicious circle, right? Whereas when you floss, you're able to take away, not only is not so pleasant, so you're not going to stay too long flossing for, but as a toothpick can give you a sensation of, okay, there's something, you stay there poking your gum. So yeah, floss like a boss. No toothpicks. No toothpicks, please.
DIY teeth whitening.
Mm-hmm.
For our young people that want nice white teeth, for me too.
Yes.
Get a nice white smile. DIY at home without coming to see you. What can we do to do it regularly so we have a nice white smile?
Well, the first thing we need to know why our teeth are changing color, because sometimes, yes, you have the natural coloring where over time your teeth change color based on your diet, etc. Maybe your brushing is all you need, getting a good toothbrush and proper toothpaste. But it's true that with time and with age, those mini cracks we talked about, you have stains going in the tooth. And even if you brush very well, your teeth get darker with time. So you have the opportunity, of course, to go to the dentist and not a beautician, please, to be able to get professional whitening. There are some whitening off-the-counter whitening that you can also have. But, I will say it's actually a prescription. So you need to know what concentration to use, if you're doing a whitening, even if it's something that you bought, on your own. DIY at home. I know my husband used to say that his grandmother used to give him charcoal to really rub on his gums every, it helps in a way on the health of the gum, but it's that contrast that he used to see that, oh my God, my teeth are looking so white because my gums are looking so dark, it's that contrast. But DIY at home, to be honest, once something has gone a bit darker, beyond brushing and those strips that you can buy maybe across the counter, I'll say professional whitening is what will take you there, because we don't just whiten. It's actually like a mini bleaching, right? And to bleach is better that it's controlled, and it's something that goes beyond, just giving you your natural shade. I'm taking you 1, 2, 3 shade lighter than where you are.
How long will I have to wait to redo that again? Because it wears off.
Good question. Yeah. It all depends. Habits. I love to talk about habits. It all depends on what you eat and how you take care of it. But averagely, I think 2 to 3 years. Yeah.
Lovely. So lastly, what basic oral health routines should we keep to actually maintain a good oral health and wellness? All
right. Well, brush 2 3 times is hard, but at least brush twice
Isn't it too
much
much,
a day.
Though?
No.
Won't that remove too much? Oh, soft paste, soft brush.
Soft toothbrush now.
Soft toothbrush.
Soft, remember? We have to push it. Let's talk about extra soft.
Soft, okay.
Yeah, extra soft. Because now we're talking about tooth massage, not just toothbrushing. So let's go extra
Focus
soft.
on the gums, removing the sugars
Focus
and
on
stuff.
The gum. And most importantly, do it at night. Do it at night, last thing before going to bed. Very, very important, okay? And when you wake up in the morning, really, your mouth is clean. So you can just rinse. If you're having breakfast, have your breakfast and brush after your breakfast, okay? Because sometimes we get the kids to wake up, brush, and then take a breakfast that's full of sweets, maybe some cornflakes and all that sugar and all that chocolates, whatever. And then they go to school the whole day with whatever they took, okay? So we agreed. Go to bed. Last thing, you brush, you wake up, your teeth are good, rinse, have breakfast. And if you have to keep your toothbrush in the visitors, the guest toilet that's next to the door, brush just before you leave the house, okay? So that, remember we're beating that time, right? So that you can keep those teeth clean throughout the day, okay? So we talk about brush, we talk about toothpaste, we talk about mouthwash. If you want to go with the chewing stick, just kidding. But keep in mind, time is what you're working with. Yeah. And time is really the most expensive resource we have, really.
Lovely.
Yes.
Where can people find you if they want to contact you?
Contacted me, Dr. Amy I'm the CEO of Smile 360. I'm the orthodontist. I'm the smile designer. And I'm your smile architect.
On Instagram?
On Instagram, Ask Dr. Amy. Yes, where I talk more to dentists because I like to really speak to dentists, dental students who, have to believe in dentistry. But there's some tips and tricks for, of course, patients and people who want to have a beautiful smile and have their life transformed.
Thank you. Thank you so much for coming to our podcast, Married with a Voice podcast.
Married with a Voice. Thank you for
thank you so much
giving
for
me a platform for my voice.
Oh, it was our pleasure having you.
Thanks.
Thank you
so much.
This is Married with a Voice podcast, healing souls one story at a time.